Hey everyone, my name is Ariel White. I am a medical legal advocate at Call for Help in the Sexual Assault Victims Care Unit, and today I am going to be presenting how to support LGBTQ people who have experienced sexual violence. Before we get started, I have a couple of things that I want to address. First of all, I am working from home. I have two littles and two dogs, and I also live by an airport. So there may be some really intense background noise. I'm going to try to keep it as quiet as possible for as long as possible, but if we have some interruptions, please be patient with me. Also, before we get started, I want to let everyone know that there may be some content in this webinar that might be triggering. This webinar does address sexual violence as well as discrimination that many LGBTQ plus people face based on their gender identity or sexual orientation, or both. So if you at all need to take a moment during the webinar, it's totally okay. You could always come back to view the webinar while it's going on, or you can come back at a different time on our sexual assault awareness page where you're viewing now. So please take care of yourself first, and let's get started. First of all, we need to recognize that LGBTQ plus people are affected by sexual violence disproportionately, and those who are also a part of a minority community are at even higher risks. I've included some statistics today, maybe a bit too many, honestly, but I'm a really big statistics person, and these statistics are actually really important to be able to see the disparity between straight cisgender people and LGBTQ plus people. So 44% of lesbians and 61% of bisexual women experience rape, physical violence, or stalking by an intimate partner, compared to 35% of straight women. 26% of gay men and 37% of bisexual men experience rape, physical violence, or stalking by an intimate partner, compared to 29% of straight men. 46% of bisexual women have been raped, compared to 17% of straight women and 13% of lesbians. 22% of bisexual women have been raped by an intimate partner, compared to 9% of straight women. 40% of gay men, and 47% of bisexual men have experienced sexual violence other than rape, compared to 21% of straight men. So already you could see that the numbers are much higher for people who are a part of the LGBTQ community, even when compared to, lesbians, for example, against bisexual women. These statistics are not all inclusive, of course, and they don't cover the wide gamut of things, but unfortunately the LGBTQ community is not one that has been studied until fairly recently, so these are the statistics that we have to work with. A couple more here. The 2015 US Transgender Survey found that 47% of transgender people are sexually assaulted at some point in their lifetime. And then among people of color, American Indian, multiracial, Middle Eastern, and Black respondents to that same survey were most likely to have been assaulted in their lifetime at 65%, 59%, 58%, and 53% respectively. Okay, so second, there are many, many barriers to reporting for LGBTQ people. These are not all inclusive barriers. I'll get into some of the other ones that aren't going to be on the screen here in a little bit. But folks in the LGBTQ community face all the same barriers, fears of not being believed, being blamed or shamed, retaliation, that straight cisgender sexual assault survivors face, and then some. So on your screen are some of the other and then somes. Disbelief that sexual violence affects LGBTQ plus people. There's a little asterisk there to bring your attention to Jaquise and Cheyenne's webinar last week on misconceptions around the LGBTQ community. Some of those misconceptions would be helpful for this webinar as well. So if you haven't had the chance to view that webinar, sorry, that's my husband yelling at the dogs. If you haven't had the chance to view Jaquise and Cheyenne's webinar from last week and you are emotionally able to do so, please do that as well. Worries when one is not out yet. This revolves around a couple of different things. When talking to law enforcement or a sexual assault nurse examiner, or anyone else for that matter, it could be really hard for somebody who has not revealed their gender identity or their sexual orientation to speak with someone for many different reasons. The uh, Having to explain in detail could potentially force them to out themselves, which is something that they may not be comfortable with. It could also mean that in the process of speaking with people or other people speaking with other people, that they are outed, which means that somebody outs the person's gender identity or their sexual orientation without that person's consent. So, big worries there. Lack of support or even outright blame and or shame from some faith communities, uh, that I want to pay attention to some faith communities there, because fortunately it's not all faith communities, but it definitely is some faith communities um, who can still be very discriminatory against LGBTQ people. So that is a big fear, especially if someone also has the worry that they're not out yet, plus, blame and shame from a faith community, and because the faith community may not even know. Not that they need to know, but neither here nor there. Fear of denial of services based on sexual orientation or gender identity. This is a big fear here in our country, in the United States. And I'm sure it's probably a big fear in a lot of other countries as well. I did include a couple of statistics there on the bottom. 85% of victim advocates surveyed by the NCAVP, that is the National Coalition Against, the National Coalition of Anti-Violence Programs, reported having worked with an LGBTQ survivor who was denied services because of their sexual orientation or gender identity. That number is way too high. Moving on, the 2015 US Transgender Survey found that 1 in 5, or 20% of people who responded to that survey, who were incarcerated in jail, prison, or juvenile detention in the past year, so from 2014 to 2015, were sexually assaulted by facility staff during that time. And the 17% of respondents who stayed at one or more homeless shelters in the past year, so from 2014 to 2015, were assaulted at the shelter because they were transgender. So many, many hate crimes are still going on. There is much discrimination that LGBTQ plus people still face. Like I said a minute ago, there are some other barriers to reporting. There is additional trauma that could be caused if one is talking to, say, a sexual assault nurse examiner. If that person or law enforcement or somebody else that they disclose to, when they're asked to explain LGBTQ topics, that could be additional trauma in the middle of another trauma that they're already facing. They could also fear that their assault will reflect badly on the LGBTQ community, so they decide not to report, because it's just another thing that people can add to, the list of bad things that they can come up with the LGBTQ community, many of which, again, are not true. Feel free to see Jaquise and Cheyenne's webinar from last week. And then also the fear of being unjustly labeled the perpetrator because they are an LGBTQ person. So uh, again, the list on your screen, the list I just went through, is not all inclusive. There are many other barriers, but I didn't want to throw everything at you all because this would be a really, really, really long webinar if I did. So let's move on here. Okay, how you can help, right? Let the person know that it is not their fault. Always. This is good. This goes for any survivor, not just LGBTQs. Um, let them know that it's not their fault. It is never the survivor's fault. Okay. Listen and don't ask for details. Listen to what they have to say. Don't ask for any details they're not willing to provide. If they want you to know, they'll include the details. So please don't ask. Validate their feelings. Okay. There's an example over there on the right. That sounds really tough, scary, intense. Validate what they're saying. Let them know that what they're feeling is okay. Express your concern and be direct. I care about you. I'm here for you. And then use inclusive language. If you're not sure of that person's pronouns, ask them. That is one thing that is respectful of their sexual orientation, that more than likely the person would not be offended by, a question that they would not be offended by in that moment. That is a question that's okay. Or you could use they them pronouns as a default. Okay, that's it's not too terribly hard. Uh, it can be really, really helpful to use they them as a default. That way you're not accidentally using pronouns that the other person wouldn't use. You can also use partner versus boyfriend or girlfriend. That partner is much more inclusive, it's more broad, and you can even use that in straight cisgender encounters, because my husband is still my partner. My ex-girlfriend was my partner. So the use partner versus boyfriend or girlfriend, much more broad. It can cover a multitude of things, and every person's significant other is still their partner, so it works. Okay, supportive things you can say. I believe you. This shouldn't have happened to you. I'm sorry this happened to you. You didn't deserve this. It's not your fault. Thank you for trusting me. I'm here to listen or help in any way that I can. How can I help you? This must be really tough for you. Some of these things we just went over. I felt like they were important enough to include them here again. Um, these are all things that are absolutely amazing things to say to anyone, but especially LGBTQ people when you're working with them. The first one, I believe you, saying those three words can change the course of an entire conversation, and could also really, really help with somebody in the beginning of their healing. So I believe you is a very, very powerful statement, no matter who you're talking to. All right, extra places to find help. The National Coalition of Anti-Violence Programs, I probably said that wrong earlier. Their hotline is there at the very end of the description. The Trevor Project is for LGBTQ youth. Their hotline is also there. The LGBT National Hotline, yes, their hotline is there. I knew I included it. They have pen pals as well. Right now, that could be something that is super helpful in the middle of all this COVID stuff. And then they have weekly LGBT and yes, LQBT. Sorry, I got that wrong. Chat rooms for youth. Um, the Association for Lesbian, Gay, Bisexual, and Transgender Issues and Counseling. That is a directory of LGBT-friendly mental health specialists across the United States. Okay. So verified members of the Association for Lesbian, Gay, Bisexual, and Transgender Issues in Counseling. Um, it is a directory for them. Forge, for ourselves, reworking gender expression. These folks are awesome. I personally had the opportunity to sit and talk with some representatives from Forge when I was doing a personal gig at the National Sexual Assault Conference in Washington, D.C. a few years ago. Our tables were across from each other and we spent a lot of time together, and Forge is amazing. Um, RAIN, the Rape Abuse Incest National Hotline, they are the hotline for all of sexual assault. They're probably the biggest organization that there is for sexual assault, um, rape, abuse. They've got resources, statistics. They have an online hotline where you can chat. They have a a hotline by phone. I apologize, it's my daughter in the background. She is not used to not being around mommy, and mommy closed a door on her. So I apologize. She's probably going to get a little fussy back there. Um, so all of these are just a very few extra places to find help. Um, if you are in Illinois, in Madison, St. Clair, Jersey, Randolph, or Monroe counties, you can also come to Call for Help. Um, so, Call for Help can also help, hence our name. So, that is Monroe, Randolph, Jersey, St. Clair, and Madison counties in Illinois. So, not an all inclusive list of extra places to find help, but a small list of some places to find help here. And these are some sources that I pulled from. I will leave these up here for just a couple of seconds while I talk. Um, the Human Rights Campaign and RAIN are where I pulled a lot of my information from. Also, for other advocates who from other ICASA centers or other centers across the United States who may or may not be watching this, if you want to provide inclusive services for LGBTQ people, there is a resource there at the very bottom. There is a resource there at the very bottom where you can find a ton of information on how to provide inclusive services for LGBTQ people. So, my apologies about my daughter, y'all. Um, I hope that this webinar was super informative for you all. I hope it wasn't too terribly long or too much to throw at you. If you have any questions, feel free to comment or message our page. We'll do our best to answer. If you have any concerns or comments, uh, please be nice about them, of course. But feel free to let us know. We are always learning. We are always growing. Even though I'm a part of the LGBTQ community, I do not know all about LGBTQ. So if I got something wrong, if you have another resource that you'd like to add, please feel free to message us, hit us up, comment, let us know, and we will be happy to engage with you, to speak with you, and to learn more from you. So for now, I will say goodbye and thank you all very much for watching. Please tune in to our Facebook Live on Friday as we go over the entire week and also do a recap over our entire month as we close out Pride Month. Thank you all again for watching and for your time, and be on the lookout for our Facebook Live on Friday.